Welcome to MedicoApp's PDS Express. In today's class, we'll be discussing question. So before starting, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we update any new video or any new quiz, you'll automatically get updated. And please do press the bell icon. Now let's start with the question. So this question belongs to ortho. Now this question has been asked in AIPG exam, and the question was, so basically it was an image based question, and the question was, the radiograph shown here, that means they're talking about this radiograph, it is frequently used in orthodontics for the study of growth and development of the head. Now name the radiograph. So basically they have given this radiograph and they were asking to identify this radiograph, and the options given were panoramic view, that is the OPG. Then second was PA skull, that is posterior anterior skull view, submental vertex view, that is SMV. And the last one was lateral cephalometric view, that is lateral ceph. Now this image, that means this radiograph, so basically it's a lateral ceph. Now here in this image you can see the landmarks. So let's start from the this frontal sinus. So this is the frontal sinus, and all these, the nose, the lips, all these, they are the soft tissues. This is the inferior mandible, this is the hyoid bone, this is the cervical spine, and this whole is the maxillary sinus, and this is the sella turcica, right? So all these, now if you are pursuing for ortho department, you'll be reading more about these lateral cephalogram. So here we are just discussing about the normal, or you can see the basic things about the lateral cephalogram. So a lateral ceph, it is a standardized reproducible radiograph which is used primarily for the orthodontic diagnosis and treatment planning. So whenever any patient come to your ortho, basically the practitioner or the doctor, they advise two radiographs for the model analysis. First is the OPG and second is the lateral ceph. So these two things, they are really mandatory for every patient to study the model analysis, and secondly to check whether it is dental malocclusion or skeletal malocclusion, right? Now what all are the uses? So first and foremost, it is used primarily in the ortho diagnosis and the treatment planning, especially if the doctor is planning for the orthognathic surgeries in skeletal malocclusions, right? Now it is useful to record the lateral ceph and the OPGs prior to the treatment, and can be used during the treatment to assess the progress. So multiple times your doctor may ask you to go for the OPG and the lateral ceph, and the basic thing behind that is they just want to check how much they have attained. Like initially they'll advise the patient to have these lateral ceph and OPG, and then once they are done with the treatment, they'll again take these lateral ceph and OPG to compare what exactly the difference came, okay, or they have accomplished the required amount of whatever they are thinking. Now it is used to assess the etiology of malocclusion. Now as I said, whether it is dental malocclusion or it is skeletal malocclusion. Now these radiographs, they can be used for research purposes as well, and for research purposes even the archival data, or if you are doing any study, you can take you can retrieve these archival data. Now once taken, lateral ceph can be traced. Now these tracings can be either manually by hand, or it could be digitally analyzed for the treatment and the planning for the orthodontic treatment. So all these, they are the lateral ceph. Now if you are pursuing ortho, you need to study more about lateral ceph, and even for oral medicine as well, you need to know the landmarks and everything, and for which conditions you are supposed to take these lateral ceph apart from ortho department. So all these, they are the features of or you can say the uses of lateral cephalogram. Now coming back to question, so this image is of lateral ceph. So this is the correct answer. Again, I'm reminding, if you have not subscribed to our YouTube channel, please do subscribe. And apart from this, we are also sharing content on the WhatsApp group. So if you want to join to our WhatsApp group, you can just directly go to this link, www.medicoapps. This is medicoapps.org/groups. So if you're a first year student, we are providing first year subject content like anatomy, biochemistry, dental anatomy, histology, physiology. If you're a second year student, we are just providing update related to your second year. Similarly for third year, final year, for interns, and for postgraduate. Hope you like the session. Thank you so much.